We're here today not to alarm the public, but to raise awareness that we have an opportunity before us right now. Now is the time that we can come together as a community so we can potentially lessen the impacts of the new COVID variant called Omicron on Chelan-Douglas, Grant, and Okanagan counties. Omicron's a fast-moving, highly infectious variant that's unlike any we've seen in the past 2 years of the pandemic. Omicron now makes up the majority of COVID cases across the world, and in Washington State, the Department of Health reports Omicron has now overtaken the Delta variant. Here in the Wenatchee Valley, we recorded our first case of Omicron on December 10th. Over the weekend, we had daily test positivity rates of 30%, and some places in Washington have had test positivity rates of over 50%. To understand a little bit more about Omicron and how it compares with Delta, I want to make a couple of very important points. The Delta variant has twice as many mutations. The Omicron variant has twice as many mutations as the Delta variant, which is causing so many of the differences that we're seeing. The Delta variant took about 4 months to peak in our area, and Omicron should only take 6 weeks. The Delta variant doubled its infection rate approximately every 2 weeks. And in communities around the nation now, Omicron cases are doubling every 2 to 4 days. Researchers believe Omicron may lead to more cases of reinfection in people who have already had COVID, as well as more cases of breakthrough infections for people that are fully vaccinated. While this variant appears to be slightly less severe, as measured by overall mortality rates and overall hospitalizations, it moves very quickly, and we're going to see everyone becoming sick around the same time. This is going to lead to staffing shortages for our critical infrastructure, such as hospitals, our schools, and area utilities. Based on the facts that we currently know about Omicron and its rate of infection, we expect Omicron to gain momentum within our local communities in the next few weeks. We should expect to see high rates of COVID infection for the month of January and then into early February.
The biggest thing that we are concerned about right now is how Omicron will impact our health systems and our critical infrastructure. And people will ask the question, why does this information matter to me? While previous COVID variants typically kind of truncated in a 6-month progressive wave, the short incubation period, as Dr. Wallace mentioned, means that will be more like 4 to 8 weeks that we're going to be going through a wave. So it's going to be very, very short. This means we must plan for many people in our community to get sick at the same time, potentially overwhelming our local medical centers and hospital. And we are already seeing telling signs of Omicron impacts. On December 27th, Confluence Health overnight went from a COVID positivity rate of about 7% to 20% positivity rate. COVID patients hospitalized at Confluence Health on average spend about 10 days. The hospital has 156 beds available for both COVID patients and patients being treated for other ailments and conditions. The Delta variant this past fall challenged our hospital and hospitals across the state. DOH projections show our statewide hospitalizations may be equal to or 2 to 7 times higher than Delta per day at the peak of Omicron in our community. These sorts of projections will put our hospitals beyond capacity, inflicting a tremendous strain on Confluence Health, Lake Chelan Health, Cascade Medical, and our federally qualified health centers, Columbia Valley Community Health, and Family Health Centers, potentially forcing hard choices by medical providers. This comes at a time when our healthcare system already are short-staffed and our healthcare workers are exhausted after dealing with pandemic conditions for 2 years. So what are we doing? The Health District and its partners are currently putting resources and strategies in place to help us better respond to the high COVID infection rates we are expecting with Omicron. Chelan-Douglas Health District is working with Columbia Valley Community Health and local fire to set up another testing site in North Wenatchee near the old station bridge by early next week. We are working closely with local providers and utilities to make sure that their day-to-day operations are maintained during this time, as well as with schools. Confluence has asked the Chelan-Douglas Health District to support it in setting up an alternative care facility to support testing and triage over the next 3 weeks. We're working with the Wenatchee Valley College to stand up an emergency operations center for Omicron, as well as that triage center. We're working to engage our community-based partners as well as to help deliver masks and at-home tests to our community as they become available. The Department of Health is distributing close to 1 million at-home tests to local health jurisdictions over the next few weeks, and we will be working to distribute those through different community partners. They're also going to be distributing a significant number through schools and healthcare providers as well. So the big things that we do right now is we ask that our community does their part. While we work to add more testing sites and mask distribution points, we ask the community also to do its part. It is not too late to get your vaccination or your booster shot. The vast majority of COVID cases, hospitalizations, and deaths in the state are among people who are not fully vaccinated. In fact, for unvaccinated 35 to 64-year-olds, the likelihood of being hospitalized with COVID is 18 times higher than those in the same age group who've been fully vaccinated. For unvaccinated adults 65 and older, they are 13 times more likely to be hospitalized with COVID-19. For the vaccinated, a booster shot will give you increased protection against getting infected with COVID. Vaccines are the best defense against COVID, but their effectiveness can wane over time. Now is the time to schedule an appointment for your booster. The FDA just fully approved the Pfizer vaccine for 12 to 15-year-olds and is in the process of shortening the booster wait time from 6 months to 5 months from the primary second dose. So if you need to get vaccinated, you can either sign up on the Chelan-Douglas Health District website or work with a number of our providers who are offering it or our local pharmacies. Consider getting a flu shot to help preserve our hospital and healthcare system capacity as well. Anyone 6 months and older can get a flu vaccine. Young children, pregnant women, people with underlying health conditions, and people aged 65 and older are at high risk for flu-related complications. Please avoid a potential trip to the hospital and get your flu shot. Wear a mask in public places or when socializing with people outside your household. Masking is still a highly effective way of preventing the virus's transmission. For the remainder of winter, consider using a disposable mask, like the surgical masks sold in stores, or switching to an N95 mask. Because of the highly infectious nature of Omicron, cloth masks worn over a number of days may spread the virus if you touch your hands to your cloth mask. So please, if you have a cloth mask, wash it daily. And then the other part is follow CDC quarantine guidelines. These have recently changed for the general public. If you test positive for COVID, everyone, regardless of your vaccination status, should stay home for 5 days. If you do not have symptoms or your symptoms are resolving after 5 days, you can leave your house but should continue to wear a mask in public places as per the Washington mandate. If you were exposed to someone with COVID and are unvaccinated or were fully vaccinated more than 6 months ago, you should stay home for 5 days and then wear a mask around others as we move forward. Try to get tested on the 5th day of exposure.
Do you expect to see possibly closures of schools in the coming months thanks to Omicron?
When we look across the country, we're seeing lots of school districts in big urban areas delaying start to school or canceling school for the next 3 weeks. One of our main concerns is trying to keep kids in school in our area. And so we are working closely with school districts, not only in Chelan-Douglas Health District, but all of North Central Washington, to implement programs to try and keep kids as safe as they can. There may be a point where, again, for our critical infrastructure, not only with healthcare, but with our utilities, with our municipalities, our roads, and our schools, that we may have to draw back, but we are not at that point yet, and we'll do everything within our power to keep them open.
Around the Delta wave, maskings, I think, was very commonplace. You would go to your store and see almost 100% adoption of masks for people who are out shopping. Lately, I personally noticed anecdotally 1/3 maskless, up to 50% maskless when I visit a major store like a Safeway. So from a medical perspective, when you walk through a store maskless or go about your day maskless, what are you risking or what risks do you present to others?
I'm going to go on the assumption that folks in the store don't have symptoms and have not tested positive for COVID. Because we're urging folks that if they do have symptoms or if they're positive, to stay at home. But one of the biggest cruxes of this infection and this pandemic is that you can spread COVID before you know you have COVID. And oftentimes you've received COVID from someone who did not know that they had COVID. So wearing a mask in public provides protection from that. When you wear a mask, you protect yourself from getting COVID, and you protect other people if there's a chance that you have COVID. And I agree that we've observed a decrease in mask adherence, and I think that followed a decrease in our case rates across the region. If folks have stopped wearing masks, now is the time to start again. And if folks have not worn masks thus far, I strongly encourage folks to start. So an N95 or a KN95 is going to be the most effective, especially if it has a strong fit. A surgical mask is also highly effective, not as effective as a N95, but I'd recommend using a disposable surgical mask if available. Bandanas and t-shirts and gaiters are not as effective, and they might have protected some in the past, but Omicron is going to be very different.